All right. So we're trying to look at how we can be able to use provocative movements to access different conditions in patients. Like let me say a patient actually has an injury in the shoulder bone, but just moving the shoulder bone normally will not really cause pain. You get it? But if you move the shoulder bone in a very aggressive way or provocative way, that's where you can be able to now diagnose that condition. Okay, so let's look at this application of this in physical examination of patient. So one of the most telling clues to diagnosis is reproducing the patient's symptoms by applying a specific provocative movement. All right. So it could be that there's a condition right there in the shoulder or in any joints, but it's still mild. But for you to pick this out, you must actually have to do something crazy to that joint. Okay. So for example, shoulder pain due to impingement of the subacromial structures may be provoked by moving the joint in a way that is calculated to produce impingement. Okay. So the patient recognizes the similarity between this pain and his or her daily symptoms. We get. So it could be that the patient is telling that this thing just started, but it's mild. But it is mild because the patient has not been really using that part of the body aggressively. So you come now and do a provocative movement, like raising the hand all of a sudden, okay, just to check out, okay. So likewise, a patient who has had a previous dislocation or subluxation can vividly be reminded of that event by stressing the joint in such a way that it again threatens to dislocate. Indeed, merely starting the movement may be so distressing that the patient goes rigid with anxiety at the anticipated results. Okay, so this is aptly called the apprehension test. Okay, so sometimes when you start and when you want to move, they might actually get that place rigid. So you mustn't move. They are rigid. That's to tell you that there's something wrong there. Okay, so this is how you can be able to access provocative movements during physical examination of patients.